Experience a membership that backs your business journey with American Express Business Platinum. When you pay with membership rewards points for all or part of an eligible flight booked with a qualifying airline through Amex Travel, you can get 35% of those points back, up to 1 million points back per calendar year. American Express Business Platinum. There's nothing like it. Terms apply. Learn more at americanexpress.com/business-platinum.
Expedia and Visit Scotland invite you to come experience the beauty that awaits in Scotland. The sweep of wild coastlines, quiet lochs, and untamed landscapes. Fresh cuisine that feels rooted in the land. Come experience the kind of stillness that stays with you long after you leave. Plan your Scottish escape today at expedia.com/Visit Scotland.
Are there signs earlier than the psychosis that people should be aware of for oncoming Alzheimer's that they should start having their loved ones see a doctor about?
So that's a really important question. So I guess the rubric that I use is that any concern on the part of a family member relative to the cognitive functioning of a loved one, even if it's really minor, should be taken seriously and should be a reason to take them to their primary health care provider for evaluation. They may find that there's nothing seriously wrong, or they may find that they have a thyroid problem, or they might find that they're anemic, or they may find the person's depressed, but it's not Alzheimer's disease. But any change should be taken seriously. Now, that being said, Jonathan, sometimes the earliest changes are in the high-level activities. Things like, managing finances, making complicated decisions. That's where we often see the earliest signs.
Hey everyone, this is Jonathan Marks from Go To Health. I hope you're having a good day. Today we're talking about the really challenging condition of Alzheimer's. Let's talk more about that. More than 7.2 Americans age 65 and older are living with Alzheimer's disease. While memory loss is one of the most recognized symptoms, many families are unprepared for another set of challenges, and they are significant. Behavioral challenges, including hallucinations, delusions, suspicions, and fear, which can be referred to as Alzheimer's disease-related psychosis. Someone with Alzheimer's disease might see people who aren't there or believe family members are strangers, behaviors that can be more disruptive than memory loss itself. Clinical research is playing a key role in improving understanding of these behavioral symptoms and their impact on daily life. Alzheimer's disease clinical trials focus on these behavioral symptoms, and they're now rapidly enrolling patients and families in multiple U.S. cities, giving families the opportunity to participate close to home. Participation typically includes regular clinical visits and careful symptom tracking and close communication with a research team. We have a fascinating and insightful interview coming up with a recognized expert in the field, George T. Grossberg, MD. He's the director of the Division of Geriatric Psychiatry at the St. Louis University School of Medicine. And before we get to Dr. Grossberg, please subscribe to our channel. And if you're watching us on YouTube, Apple, or Spotify, please give us a thumbs up or a 5-star review. That helps get the word out to more people. You can also visit us on our website at gotohealthmedia.com, where we have hundreds of shows that can educate you on a variety of health topics. Thanks in advance. So welcome to the show, Dr. George Grossberg. How are you today?
I'm feeling great, but thank you for having me.
Good. So tell us, what are the behavioral symptoms associated with Alzheimer's disease, and what do they look like? I mean, a lot of families may see behavioral shifts, and how do they know when they should be getting attention for this?
Yeah, I think those are great questions. Behavioral symptoms in Alzheimer's disease, first of all, are very, very common. So if you look at the whole range of different behaviors that can occur that are out of character for the patient, by the way, almost everyone has something during the course of the disease. Today, our focus is going to be on psychosis in Alzheimer's disease, where patients actually begin to hallucinate. They can hear or see things, which can be very distressing. or become paranoid or have firm false beliefs that maybe their family's trying to harm them. These are called delusions. And what is really important is to look at these because they become very impactful. They really affect quality of life. They can cause significant amount of distress for both the patient as well as the family members. When families see these neuropsychiatric symptoms or behavioral symptoms, especially when they're making an impact, it's very important to share that with their primary healthcare provider and then to become aware of more information and resources and treatment opportunities that are in the pipeline for these symptoms.
In general, how ready are health professionals to share these kinds of, warning signs or symptoms with the families so that they feel like they're getting enough support?
Yeah, that's a really important point, Jonathan. Unfortunately, healthcare providers, all of us are very, very busy. And sometimes, we're just busy taking care of, the blood pressure and the vitals and all kinds of other things. And we got people waiting in the emergency room. We may not always have enough time to provide resources, to provide the level of support that families need. And that's one of the reasons why I think, a website we're going to share in a little bit with everyone is so important, to get more information and to identify resources and support services. And even the notion of volunteering for a clinical trial provides more support, more resources for both patients and families.
Good. So let me give that website right now so people can get that. It's navigatingalz.com. Navigatingalz.com. Who's that put out by, Doctor?
Well, it's actually sponsored by a pharma company, but it's not a medication or any particular medication focus. The focus is on more information about psychosis and Alzheimer's disease. And then there is a listing of the different sites in different parts of the country where one can access treatments for psychosis and Alzheimer's disease, as well as to benefit from all the support systems that these clinical trials provide and make people aware of who have psychosis and Alzheimer's disease and are being cared for by their families.
Is psychosis very common as Alzheimer's progresses?
Absolutely. In fact, we used to think, Jonathan, that, it's most common, which is still true later on, that you only see it in the more advanced disease. But the reality is you can even see it very early. But about half of individuals at one point in time will be affected with either the hallucinations and or the delusions that constitute psychosis and Alzheimer's disease. So it's very common.
So this is really so important for families to know about to get the kind of support they need. I mean, I think most of the focus has been on the patient's brain and not the caregiver's brain and how they can really, help people help their loved ones get through this.
Yeah, no, that's absolutely. In fact, I call the caregiver, the care partner, the family members, my second patient, because we always touch base with them at every visit to see how their health is. How's your physical health? How's your mental health? Because if they get sick, if they decompensate, they can't do anything for their loved one. So we have to focus on both the patient as well as the family.
That's so insightful. I'm so glad you mentioned that. So you mentioned earlier clinical research. Why is clinical research so important? And how do you know if a person is actually eligible for a trial?
Those are great points. So I think as our audience, and as you and as the audience knows, in order to get medications approved by the Food and Drug, we have to go through the process of clinical trials. In the area that we're focusing on today, which is the psychosis and Alzheimer's disease, the early safety studies have already been done. But now there are additional studies in sites all over the country just to see how effective, continuing to monitor safety, but to see how effective these new medications might be for psychosis and Alzheimer's disease. Making a call or getting on the website and finding the center near you. When families make the call to the clinical trial site, the process begins. They may do some initial screening on telephone, and then they'll often have you come in on site to do additional screening to see if your loved one might be eligible for these new treatments.
Hey all, Jonathan from Go to Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go to Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GoToHealth at checkout. That's code GoToHealth at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus. What would be an incentive for a family to participate in a clinical trial? Because they're dealing with problems right now. I mean, crises right now. And I'm assuming clinical trials take a while to actually do. And then the research has to be, tabulated. And then, then a result happens much later. So what's the incentive for people to participate?
Yeah. So generally with clinical, that's a good point as well. So generally with clinical trials, once people become eligible, they do start treatment right away. Not everybody gets the active drug, but once the relative short trial, usually about 12 weeks or so, is over, then everyone gets the active medication and they continue to be followed over time to make sure that it's helping and to make sure it's effective. There's also the concept, Jonathan, of a rescue medication, meaning that if somebody does wind up on the placebo, the dummy pill, and they have residual symptoms, there's an emergency intervention medicine that can be used to help get them through the clinical trial. So everything possible is done to monitor for safety and for efficacy and to help the patient and to help the family, because these symptoms are also major triggers for institutionalization. One of the major triggers for ending up in a nursing home is having something like untreated, unmanaged psychosis in Alzheimer's disease.
Got it. So what's the one thing you see on the horizon that gives you hope that we can finally stop this behavioral decline really, I guess, the destruction of the family unit?
Yeah, no, absolutely. So I think we have a lot of hope for the disease itself, and our goal is obviously prevention, but we're not there yet, but hopefully we will be one day. But while we have the disease with us, to be able to recognize early is very important. Recognize the psychotic symptoms, the hallucinations, the delusions early. If we have effective and safe medications to begin to treat early, and that can help even slow disease progression. And of course, make it possible for the families to keep their loved ones at home longer than previously. That's the goal, and that's the hope.
Good. Thank you so much. Are there any questions I haven't asked that I should have, or is there a big message you'd like to leave with people today, Doctor?
Yeah, I think you asked great questions and really to the point, so I appreciate that. But again, just one final note is that keep in mind that if you have a loved one with a personality or behavior change, particularly psychotic-like symptoms, bring them to attention of your family healthcare provider and make sure you get on that website, navigatingalz.com, to get more information and find out about clinical trials that might be helpful.
Let me ask one more question, Doctor, before we go. Are there signs earlier than the psychosis that people should be aware of for oncoming Alzheimer's that they should start having their loved ones see a doctor about?
So that's a really important question. So I guess the rubric that I use is that any concern on the part of a family member relative to the cognitive functioning of a loved one, even if it's really minor, should be taken seriously and should be a reason to take them to their primary health care provider for evaluation. They may find that there's nothing seriously wrong, or they may find that they have a thyroid problem, or they might find that they're anemic, or they may find the person's depressed, but it's not Alzheimer's disease. But any change should be taken seriously. Now, that being said, Jonathan, sometimes the earliest changes are in the high-level activities. Things like, managing finances, making complicated decisions. That's where we often see the earliest signs.
Got it. Thank you for that. It's been really good to have you on the show today and educating us about Alzheimer's and actually the clinical trials that can help people and the website that can really help caregivers. Let me mention that again. It's navigatingalz.com. Thanks so much for being with us today, Dr. Grossberg.
Thank you.
We've been talking with George T. Grossberg, MD. He's the Henry and Amelia Nasrallah Endowed Professor. He's the Director of the Division of Geriatric Psychiatry at St. Louis University School of Medicine. Thanks again for being with us, Doctor. It's been very elucidating.
Yeah. Nice being with you. Thank you again.
Good. This has been Jonathan Marks. Remember, you can visit our website at gotohealthmedia.com, where we've got hundreds of shows you can learn from. You can also watch us on YouTube or Spotify or Apple. And if you do, please give us a thumbs up or a 5-star review. That helps us get the word out to more people. This has been Jonathan Marks with Go to Health. And as we say at the end of every show, go to health. God bless. We'll see you again next time. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.
Stitch Fix. Stop shopping, get styled.
A+ on the outfit, Miss Turner. You are about to slay parent-teacher conferences.
Oh, these? Just the most perfect fitting jeans my stylist sent me.
Oh, hello, you, who didn't set one foot in a mall and still looks amazing.
Just share your size, style, and budget, and your stylist sends personalized looks right to your door. Stitch Fix. Get started today at stitchfix.com.
To my stylist. This look is dedicated to you. Thank you. Thank you.